Hello, it's Dr. Sina here with my dog Fred, who is a puppy, so she's probably not going to last very long. In fact, there she goes. And today I'm going to talk to you about probably one of the most frustrating and annoying conditions that you might see in your dog. So I'm going to talk about the itchy dog. And by the itchy dog, Freddie, shh. By the itchy dog, I don't just mean the occasional scratch. I mean that dog that is so itchy, they're pulling out their hair, they're leaving red marks, they're really uncomfortable, constantly licking at themselves at night time. You can't sleep, they can't sleep, they seem really unsettled and just really not right. So when we have a dog that comes in to us as veterinarians and we have an itchy dog, there are a few basic things that we tend to look for because there's not really that many things as far as categories go that are going to make your dog itch. The main ones that we look at is, number one, do we have fleas? Fleas are super common and they can cause some really nasty allergic dermatitis, and it's not always the same in some dogs. So we can have a family of dogs that come in and one dog will be tearing themselves apart by the fleas and another dog will still have fleas on them, but they'll kind of be, yeah, it's not really bothering me. And I liken it to when you're sitting around a campfire at night time and you're out bush and one person is getting attacked by mozzies. Mosquito bites everywhere, they come up in big red welts and they'll be itchy for days, but then there'll be other people sitting there that don't even get a bite and they're like, oh, what's the big deal? Like mosquito schmito, like it's just not a problem. And dogs are like that with fleas. Some, they really don't bother terribly, but some get really, really nasty reactions to them. So number one, let's make sure we've got really good flea control and we don't have fleas. So once we can do that, we can check that relatively simply for most dogs. The next common cause of itch is allergic skin disease. And this is probably by far the most common cause and also by far the most frustrating cause because it is really hard sometimes to identify what the allergen, which is the thing that is causing the allergy, actually is. The other thing that's going to cause itch in pets is going to be infections. So by infections, commonly we see bacterial infections and sometimes yeast infections. They're definitely the most common things, and how we test for that is doing some pretty simple but really important testing where we get a sample of the surface of the affected skin, or sometimes we have a look at what's inside pustules or in fact what look like potentially infected areas and have a look under the microscope. Are we identifying any pathogens? So pathogens are just things that are causing pathology or making you sick. And so we will look for things like bacteria commonly or yeast. Those two are the most common thing. Unfortunately, these days we are seeing a lot more what we call resistant bacteria. So those are bacteria that are not going to be responsive to most of our antibiotics. They can make treating those can be super, super difficult, and we will often go down the path of topical medications and sort of disinfectants for treating those depending on how severe they are. And generally the only way that we can tell if we've got a resistant infection is, number one, we find that our dogs aren't responding. We know they've got a bacterial infection, but then they're not responding to the antibiotics in the normal way that they would. Then the other thing, so if that's not happening, we take a sample from the skin area that's affected, send it off to the laboratory and they will actually grow up what is causing the infection and test it to see, okay, are there antibiotics that are going to be effective for treating this bug? Super important step if we are concerned about a resistant bacteria, or what we call a methicillin-resistant bacteria. Then once we have a look at that, so if we've got infection, fantastic, we treat that. If we don't have infection, the other things that we may see or might have are kind of other abnormal or less common metabolic disorders. So disorders within the body that make dogs more prone to having skin issues. Examples will be liver disease, a disease called Cushing's where the body's producing too much cortisol in the adrenal glands, or hypothyroid disease. So often we will like to do some blood work on your pets, specifically if they're a little bit older, or we have a few other sort of telltale signs that we might be concerned about, to have a look to see whether we've got a metabolic condition that can impact the skin and can lead to an infection or itch, etc. Now, I want to go back to allergies and focus on that for today's talk, mainly because that's the most common thing and probably the most annoying disease, I think, for most people if your dog does have skin disease. When we talk about allergies, so we've broken it down, do we have infections, do we have fleas, etc., etc. We looked at, no, we don't have any of that. So then we look at allergies. Allergies tend to be what we call atopy, which is an environmental allergen. It's this broad kind of term that says, all right, so we have a look at our allergy. We've done some food trials. We don't have any fleas. We've kind of ruled out a few things. Then we have this big, broad-ranging allergy called atopy. Now, when I say environmental allergens, that is a super big, broad range of things. Plants, pollens, grasses, sometimes mosquitoes, sometimes cockroaches, dust mite, house mite, all those kind of things get sort of circled and encapsulated into this sort of atopic skin disease. There's a few different tests that can be done to test for atopic skin disease. Some of them are certainly better than others. And the most conclusive test that we have is actually where we do what we call intradermal skin testing, which we tend to send you off to a veterinary dermatologist for, because they need to shave a patch of fur, pop little samples of common allergens into the skin area and assess the body's response to them. From them, we can work out and do an allergy serum and to attempt to try and desensitize your pet to the allergens that come up as positive. And that's a really good thing to do if we've got an atopic dog. It doesn't always work and it doesn't always get to the bottom of the allergies, but you know, if you do have a young atopic dog, it would be an important step in trying to minimize the effect of those allergens in them for the long term. The other thing that we have is food allergies. And a lot of people kind of come in and say, well, I've changed the diet and that must be why it's scratching, and I've given them a grain-free food, or I'm doing this and I haven't changed the diet and the dog started itching, so what can it be? The truth is, only about 10% of allergies are caused by foods. It might even be less than that, kind of. I think the jury's a little bit out. So when we suspect a food allergy, we're often looking at a continual allergy rather than a seasonal allergy for the most part. And we do what's called a food elimination trial. So food elimination trial is essentially where you remove all the common proteins and carbohydrates from the diet and give a really, really strict elimination diet to try and minimize the pet's dietary intake, to assess, you know, if we can do this and we stop the itch, then fantastic, we know that we've got we're responsive to the food. How do we do that? There's a couple of ways to do it, because a lot of pet foods have a lot of different proteins in it. So your common ones, chicken, beef, lamb and pork, I guess, there's a lot of those proteins around. We look at unique proteins and often single source proteins. So when we look at unique proteins, probably the more common ones we're using these days are crocodile, and probably, a lot of dogs have access to things like duck, and they have a lot of access to kangaroo now. So if I'm going to choose a true allergy diet, I will tend to use what we call like one of the Prime 100 diets, which is a veterinary diet, which is a crocodile and tapioca. Tapioca being a very unusual carbohydrate source, and the crocodile, of course, being a very unusual protein source. We try and pick a protein that the pet is very unlikely to have had much exposure to in the past. That diet, particularly for a big dog, can get expensive. And so, you know, we'll often work hard to try and find alternatives, have a look at what they've had in the past. The other option is to get a commercial diet, and those commercial diets tend to be what we call hydrolyzed. So they still use common proteins, but they're broken down into tiny, tiny components. So the body, when they're actually recognizing those proteins, can't recognize those proteins as being ones that they've seen before. So they kind of look unique, and that way we can sort of use a more commercial diet, because for some people it is just easier to do that. It's a little bit more cost effective, the food stores longer, you can keep it on a shelf for longer, so there are benefits for going down that path for some people. Food allergy diet, so during that time you have nothing else, so no other food, no other treats, can't pick something up off the ground. You know, if someone's left a bit of meat pie hanging around on the floor, you're in the park, you know, your dog can't have any of that. So it's strict and it's not easy. I actually don't know how I would go doing a true elimination diet for my pets. I've got 2 dogs, 2 cats, 2 kids, you know, and a husband, and trying to get them all online to do a true elimination diet. It's not easy, but it certainly is something that we strongly recommend if we are suspicious of a food allergy that's causing skin and sometimes gastrointestinal issues as well. Of course, if we get a positive response to the food elimination trial, then we try and challenge. We pop some different proteins in there and try and work out, okay, which is it that the dog is allergic to? The common things are chicken and beef. They're by far the most common proteins that we have issues and allergies with. They tend to be the biggest, you know, culprits. Occasionally, some of the carbohydrates are to blame, but they're certainly not as common. But going through the elimination process is the way to get to the bottom of it. And then if you do a challenge, your dog starts itching again, of course you can know bang what you need to eliminate from the diet. You do need to be careful when it comes to then going on to commercial diets, because if you do have a really strong response to the allergy, a lot of commercial pet foods don't have the capacity to truly eliminate those proteins from the production line. So if I did come back and I found a dog that was really sensitive to chicken, and it was a very strong response, then I would be looking at either formulating a good homemade diet, so you've got control within your own kitchen, but again, you do need to have nutritional advice for that. Or I would probably use the Prime 100 range, because they do certify that they don't have cross-contamination going on when they're manufacturing their foods, or look down the hydrolyzed protein path. So there are options. The other thing I guess that we need to have a look at is quite common, just contact allergies and irritations. So sometimes when your dog goes running out in the park on the grass, they'll come back and their feet will be itchy, or particularly like Daxies, we'll see their bellies will be itchy. And that's more of a contact irritation and sensitivity than a true allergy. And that sensitivity sometimes needs a little bit of surface cleaning, so giving a good wipe down after they've been to the park. Or sometimes, you know, topical medications, aloe vera, something nice and soothing on the skin may even help a little bit. If your dog does have a real allergy and you're looking at an atopic pet, then there are treatments that are available, and certainly from the days when I graduated 30 years ago, there's been some huge advances in treatment, and so it is something that you do need veterinary advice for. Antihistamines aren't as effective in most dogs as they are in people, which is a real pity, because it'd be nice to be able to have something that you could get over the counter at a pharmacy to help, but they just don't always work. In the old days, we used to use cortisone and steroids a fair bit, and while they are effective, they can have side effects for long-term treatment. And if your dog has been dispensed them or recommended them, then definitely worth having a good discussion with your vet about, okay, if I do need to be it on long term, what are the side effects? What do I need to look out for? Making sure that everything is okay. They do need to be monitored closely. Then we have the cyclosporins and and then also medications, so newer generations like Apoquel, and probably one of the biggest advances that we've had is a injection recently called Cytopoint, which doesn't have the same side effects as a lot of the other medications and is really good, and we've seen some excellent responses and effectiveness from long-term use, and has certainly worked at giving pets a lot of relief for those really truly environmental sensitive pets. So I hope you found this really useful. It's sort of our look when a vet comes in to see us, how we look at an allergic dog or an itchy dog, and the process that we go down, and trying to explain a little bit about why we like to do tests and why some things aren't just super easy to get to the bottom of, and that occasionally there is a process that's involved to find out what is causing the itch in your